Okay, here we go. Our vaccines have arrived. So, with most people in healthcare, the past 8 months have been very stressful for nurses, pharmacists, doctors, environmental service, anybody in a hospital. So, for me, this is personal. It's been a rough 8 months, sometimes 7 days a week. But this may be the beginning of the end. But in order for that to occur, it's going to take everybody participating, and that includes vaccinating. The data's there that we have right now. It's safe and effective. I would encourage it. I'm going to take it. And this is the beginning of the end for this pandemic, I hope and pray. So this is the tracker. So we're going to stop the... So this is to assure that it maintained the negative 70 degrees centigrade, and I'll show you where we're going to store this, a freezer we purchased just for this moment. Okay, so this is our dry ice bundles here. Yep, there we go. So I'm going to go ahead and just put on some cryogenic gloves. As you know, dry ice can cause burns, freezer burns. So there's the dry ice if you want a picture of it packed in there. That's to keep it at negative 70. So, whew, and that is cold. Wow. That's very cold. And here is our vaccine. Okay. Thank you. There it is right there. So there is the vaccine. Whew, I can feel the freeze on my hand. It's coming out. You can definitely feel the chill, even with these cryo gloves. This is chilly. Keep pulling, Michelle.
Okay.
Woo.
Watch out.
Okay.
Yay!
Okay. Okay, so let's break this.
Look at that.
Can we redo that?
Yeah, we started.
Okay, guys, we are here. So what I was saying, to me, frontline pharmacists with this whole COVID pandemic, the beginning of the end. So we have 195 multi-dose vials, 5 doses per vial. We can get 6 doses out of each vial. These are our doses. So here's our freezer, negative 70. Right here.
Yay. All the
And
way.
there we go.
Push it all the way. Push it. There you go. Hooray.
We got it.
What an exciting day. We've been waiting for a long time, like you said, beginning to end. So why is it so important that we get this vaccine?
Well, this is our best opportunity to date to end the shutdowns, end having to wear masks, to end the pandemic and the pain and suffering that goes with it. The vaccine is what will lead us to the herd immunity, if you will. So we encourage it. I'm going to take it. Dr. Wiley's going to take it. We'll be first on the list tomorrow. And when it becomes available to the community and outside of hospitals and first-line healthcare workers, we encourage people to take it. It is your decision, but the data that we have to date, it is effective and it's safe. So it's been a team effort, administration to nursing to pharmacy, environmental, you name it. It's been a team effort since the pandemic started, but we're tired and we're running out of resources. So could this vaccine be our catalyst to ending the pandemic. We pray and we hope so. We feel confident it will. Just with measles and mumps, polio. As a pediatrician, Dr. Wiley, you're well aware of what vaccines do for your patients, your young ones.
Definitely. And you stop and think, how many people are going to have to get this vaccine? What percentage of our community will need to get it for us to get an effective herd immunity to really start blunting the effect of COVID in our community, in our nation?
Yeah, we're going to need to get up around 70% or more. It can't just be the healthcare workers getting it to protect ourselves. You have to be a part of the process to protect the community. So this truly is a team effort. But we need the city of Abilene, 100,000 people for easy math. We need 70,000 to get vaccines. And that is eventually, hopefully by the first quarter of 2021, it's available to everybody, not just frontline healthcare workers, but all of you in the community.
Yeah. So, as far as for vaccines and for the efficacy, the ability of this vaccine to work, we're talking like 95%, which is outstanding.
Yeah.
And the side effects, the first shot is kind of like the flu shot, and so you're going to be a little achy, maybe a little sore where you got the shot. The second shot, which occurs 3 weeks later, you may get a few more side effects just because your body is starting to react to that vaccine, which is a good sign.
It's a good sign.
But after
it's working.
Yeah. How soon does this vaccine start working? What I've heard is maybe as soon as 7 to 10 days.
7 to 10 days. If you look at the studies and looking at the pictures worth 1,000 words, if you look at the line of those who got the vaccine and those who did not, the placebo, as we call it, at about day 7 to 10, you start seeing the line diverge, meaning people are still getting COVID in the placebo, not in the vaccine group. So we see it at about day 7 to 10. Getting one dose does give you some immunity. Is it lifelong? We don't know. But getting the second dose 21 days later, if it's the Pfizer brand, which is what we have here at Hendrick, you're looking 7 days after. So day 28, you're looking at 95% efficacy. So that's unheard of with the vaccine. It's very impressive. So if someone tells you the vaccine doesn't work, I can tell you, based on randomized double-blind placebo-controlled trials, based on the studies, they're wrong. It does work. From a safety signal, we haven't seen a lot of severe issues. A lot of gossip out there, but on your second dose, you're going to feel a little worse, but that just means the vaccine's working. That's what you want. You want an immune response. So it's been shown to date to be safe and effective. We're excited. We are excited. This may be the end of our 8-month battle. It's been tough in the hospitals. And it's going to protect grandma, grandpa, the old, the young. You couldn't have Thanksgiving with your family. Well, what if we get to 70%, Dr. Wiley, and next year your ski trip to Santa Fe, New Mexico shut down, you're on your Christmas ski trip. You're going to the cabin. You're meeting with your family, all 30 of you, without the worry of someone walking away sick and maybe even dying. This is the beginning of the end for me, for this pandemic. I'm excited. This is a very, very great moment in medicine and in science and in research, and I embrace it. It's emotional. We embrace it.
In this first tier, the focus is going to be on our healthcare workers, our healthcare providers. And my encouragement, my plea to everybody who is in that first tier, we need to set the example. We need to be first in line. This vaccine is essential for our community, for our families, for the success of what we need to accomplish over the next few months. So I encourage all our physicians, our nursing staff, our respiratory therapists, anybody who cares for patients when they're in our hospital, they need to get this vaccine. As Dr. Perry mentioned, there is going to be a second tier when we will be able to get the vaccination for other members of our community, for the folks who are not in healthcare. That is equally as important for you to get that vaccine because you are part of our community. And again, we need 70% of our community to get that vaccine for us to develop herd immunity, for us to be able to blunt the effect of COVID and to return back to normal.
Hi there, I'm Dr. Daniel Canario. I'm infectious disease, and we're so glad to be getting the coronavirus vaccine. To get it over here, it's been an amazing team effort. The data on the vaccine is very safe, and I feel very comfortable getting it myself, and I'm planning on getting it tomorrow. and I encourage everyone to get it. Thank you.